So the first question that we have is, what is mesothelioma and why do I have fluid in my chest? Let's take the second half of that question first. And let me go to my colleague, Joe Friedberg. Joe, if a patient has fluid in the chest, why do they have fluid in their chest?
So, funny you should ask. Look, I actually drew a picture. I thought we could start off. This is what I draw for all the patients because mesothelioma is a very rare disease. If we open you up like a book, this is basically what you would see. So you're facing someone, you've opened them up like this. This is the diaphragm here, and this separates the belly from the chest. And then the chest is comprised of two spaces. You have the right chest cavity with the right lung. So you have the lung comes down here, splits into the two sides. And you have this lung in here, and then you have this lung over here. Separating these, and these two spaces are separate with the two lungs. Separating them is a region we call the mediastinum, which is primarily occupied by the heart, which sits here suspended in this very tough leathery sac called the pericardium. But then all the other things separating the two lungs is you have the spine, you have all the blood vessels going into and out of the heart, you have the esophagus, which is the swallowing tube which goes down to your stomach. And all these things comprise the mediastinum. So lining each of these spaces here is a membrane which is about as thick as a sheet of paper normally. It starts at the root of the lung over here, and it comes up along all the ribs, and then it goes down along the diaphragm, which is your breathing muscle down here. Then it comes along the bottom of the mediastinum, and then it comes back and it folds back on itself and coats the entire surface of the lung. And each lung is comprised of units called lobes. The right is the larger of the two lungs and has 3 lobes, so you have a lower and a middle lobe, and it goes between that. Then you have an upper lobe here, and it goes between the middle and the upper lobe. It comes down, and then it folds back on itself one more time at the top of the mediastinum here to complete that circuit. That membrane is called the pleura, and mesothelioma is a cancer that starts in the pleura. The pleura is a very common place for cancers to spread to: breast cancer, colon cancer, pancreatic cancer. They all go there. That's a very common condition. It is a very uncommon place for cancers to start. Of those uncommon cancers that start there, mesothelioma is the most common. But when I say most common, it's maybe 1 or 2% as common as lung cancer, for instance. So maybe 3,000 cases a year in the United States as opposed to 170,000, 200,000 cases of lung cancer. So it's a rare cancer. The reason you have fluid is this. At any given time, there's only a few teaspoons of fluid between the lung and the lining of the chest cavity over here. And it's so little you can't even see it on a CAT scan or an X-ray. That said, every day, about this much fluid, a couple cups of fluid will come out of the lung, and it's a dynamic equilibrium. It comes out of the lung and gets absorbed by the lining of the chest cavity, primarily along the diaphragm. But fluid comes out, and then fluid gets absorbed at the same rate, so that you only have about a teaspoon. But if something throws that balance out of whack, then the fluid can accumulate. And in the case of mesothelioma, it's basically like putting up a dam. You have your stream overflows, and you end up with a lake down here. And this is where the fluid comes from. And fluid is not compressible. The lung, a human lung, has the consistency of a sponge. So the fluid accumulates, the lung gets squashed, and patients get short of breath. This is the most common presenting symptom for mesothelioma. Patients will show up short of breath, and it turns out that they have fluid in the chest cavity. So that's what mesothelioma is, and that's how it results in the fluid buildup.
Thank you.